Hi, everybody. Welcome to another episode of Your Health, Your Choice. Today, we're doing something a little bit different, and I would like to introduce everybody to Patsy Giarda, who is our pediatric nurse practitioner extraordinaire at Wholistic Pediatrics and Family Care, and she is really the steady hand of our primary care aspect of our practice. So, everybody, please welcome Patsy. So today I wanted you on the show because, a lot of the time I've been talking about what our philosophies are. We've brought patients on, we've brought some experts on, but I thought it would be nice for people to kind of get to know some of the other important cogs in our wheel here, and certainly nobody better to start off with than you. So why don't you tell us just kind of a little bit first about your background, your educational background, and kind of so people can get to know you.
Yeah, absolutely. And thank you so much for having me. I'm so excited to be here. To start, I got my Bachelor's of Science in Nursing at Florida State University. And I worked in the pediatric unit and pediatric ICU in Tallahassee at Tallahassee Memorial Hospital for about 3 to 4 years, and then decided that I was ready to take those next steps, excited to become a nurse practitioner. That was always my goal to start. Florida State University definitely instilled going on and proceeding with education. And for me, I knew it was in advanced nursing practice and becoming a nurse practitioner. And for me, the roads of acute care or primary care, the decision was easy. I knew I wanted to be in primary care. My whole life, I've wanted to be in medicine, and pediatrics was always my calling. So I knew I wanted to be as much fun as the hospital can be. And as much I learned there, I knew I wanted to be on the other side, and I wanted to be in the office with those babies, seeing them when they're well and guiding those families. And I went on and applied to University of South Florida for my master's in nursing and moved to Tampa. And that's how I met you.
Gotcha. Yeah, so talk a little bit about that. So for people who don't know, I have been on faculty at the University of South Florida College of Nursing for, I'm guessing, about a decade now, where students who are going to go on to become nurse practitioners do rotations through our office. They get to shadow me. They kind of get to learn our way of thinking a little bit, kind of expanding their horizons beyond the typical education that a lot of nurse practitioners would have. So tell a little bit about how it was that you ended up connecting with us.
Yeah. So at the University of South Florida, we are assigned our clinical rotations. So I call it the best luck to be assigned to you, Dr. David, and do a rotation through Holistic Pediatrics and Family Care. And it was an observational clinical rotation for only 40 hours, but I was just taken aback at you as a pediatrician, and we kept in contact after those that first semester in my clinicals, and I knew I wanted to come back and learn more. So even after I graduated, I came back and sat in for further sessions with your patients and consults, and we stayed in contact. And then once I graduated and was certified, I landed here, and I'm so thankful that I did.
Yeah, and in particular, like, what was it about us and what we were doing? I know you had other clinical experiences. What was it really that spoke to you about what we were doing?
Yeah. So I did have other, even, just primary care, general pediatric office clinicals. And what I saw different here was the big picture that you had, and the care for not only the babies, but the moms and the siblings and the whole family dynamic, and caring for them like they were your family. It just touched me, and it was something that I knew would fit well with my personality and how I would want to practice.
And, obviously, besides just, the overall approach that I have towards people, obviously from a holistic perspective, which was certainly something that, did you have any previous knowledge about anything with holistic medicine prior to walking in the door?
Very little, very little. I learned so much from you, Dr. David. So it's become, a huge passion of mine for preventative health measures to prevent disease. And that was always something that I was really passionate about, is seeing so much in the hospital of children, really critically sick or injured, and just having those preventative measures ahead of time. What could have been prevented. And so thinking about, from the immune system perspective, I knew that probiotics were good. I knew that vitamin D was good, but didn't really have the knowledge base that I have now and that I love to share with families.
Excellent, excellent. Well, as we, our show, Your Health, Your Choice, and certainly one of the things that we absolutely profess around here is choice and options and the respect of the individual family, recognizing that people are coming from all different, walks of life, all different shapes and sizes, etc. So, I'd like to talk a little bit about some of the choices and the medical choices and some of the things that have kind of come up for you throughout your time here, and in particular the things that you're hearing from the families, because obviously some families are interested in some things that we do, and some families are interested in other things, and some families are interested in everything. So why don't we talk a little bit first about birthing? You do the majority of our newborn babies and our early infancy child checkups, etc. So one of the things that frequently, which we hear about, and one of the things we first ask is, well, where was this baby born in the first place, or how things were. So talk to us a little bit about some of the birthing choices that you hear about, and some of and some of those considerations.
Yeah, absolutely. So that is one of the very first questions is, after, how are you doing today? And how's everything going? Where was baby born? First question, because so much stems from that, and how the family decided to, how their decision was to deliver wherever it was, because sometimes that it's different than how they planned. So a lot of choice for families in the Tampa area, especially. Some families decide to have a home birth where a midwife will come to their home. Some families decide to deliver at a birthing center, which is kind of like a house that has a very homey feeling, where families can deliver at the birthing center by a midwife. And some families choose to deliver at a hospital, either by a midwife or an OB.
Yeah, and in being in a birthing center as well as a home birth, I find does certainly afford families the most amount of choice. Certainly, when in a
Mhm.
hospital, there are some pretty regimented things that go on there.
Yeah.
Both of our children were born at birthing centers in the water, in the tubs, and it was such a remarkable experience to be able to have that. Being in the tub with my wife Lydia, and just being able to be part of that experience as opposed to a bystander, which a lot of dads end up being. And to be really being part of it was just a really just such an amazing experience to be there right for that. And one of the things we also realize, and why we often encourage families to do prenatal consults, is the recognition that sometimes the choice that the family wants doesn't work out. And kind of,
Mhm.
as you alluded to, sometimes they have to birth at a hospital. And I know that one of the things that we like to do is to offer ourselves to the families, because if they're going to a hospital unexpectedly, there are going to be some choices and decisions that they may have to make there that they wouldn't ordinarily have to make. So maybe you can talk a little bit about some of what those could be, and some of those considerations.
Yeah, so some women who plan to deliver at a birthing center, something may come up in the birthing process that it's more appropriate to finish delivering that baby or have mom and baby transfer to the hospital afterward. Or maybe something comes up later in pregnancy where the family needs to deliver at a hospital. And having a birth plan in place gives that family more leverage, I guess I should say, is the best way to say it. It gives them a little bit more voice with their choices that they want for their child, whether they want nursing students in the room when they deliver, whether they want an epidural offered or not. And having those simple choices, whether they want some family in the room, whether they want music played. And when those wishes are written out and you can provide those to the care team in a moment where a woman is in labor and there may be high stress moments and you're not able to fully portray your desires at that moment, having it written down, it's all right there. So having that birth plan on paper in a hospital bag ready to go is always our recommendation.
Yeah. And there are certain things that will come up even in terms of some of the choices, because, we certainly hear
Mhm.
about people asking about some of the interventions that are done, such as hepatitis B vaccine, and whether a family,
Mhm.
we know that, this is something that is standard of care, but we certainly get asked questions. Is this something that's necessary for us to do at a newborn period? Some people will recognize, hey, we tested, mom tested and she's negative. And so in terms of that transmission, certainly if a woman tested positive for hepatitis B, we would strongly encourage them to have the baby be vaccinated at that point, as long as the immunoglobulin, because we know that that could actually prevent the baby from catching hepatitis B. But other families would certainly be like, hey, this isn't really a high risk situation. Quite frankly, we're not expecting our baby to be shooting up or having sex anytime soon. And so, is this really a top priority thing? And that's one of the considerations they have. And some people choose to do it, and some people don't. But certainly, as we talked about with other vaccines too, there's always the weighing of the benefit versus the risk when it comes around to that. Now, I know one of the other things that people ask us about is vitamin K. So, why don't you talk to us a little bit about that?
Yeah, vitamin K is a standard injection in most hospitals. Many hospitals don't offer any other alternatives, but there are other alternatives. And well, vitamin K to start is a vitamin that is essential in the clotting process. And babies aren't born with the ability to make vitamin K on their own. So after a few months, they're able to make enough on their own. But in the neonatal period after delivery, we want to make sure that they have enough so that way they can clot to prevent neonatal bleeding disorders and things like that. So our guidance is always to not skip the vitamin K altogether. We like babies to receive vitamin K, but we always want families to have that choice that if they don't want to give their child the injectable form of vitamin K, which goes into the muscle, it can be given orally, and we have a protocol for that. And I always guide families on how to do that if that's their choice.
Yeah, and a lot of people don't know that many countries, Australia, New Zealand, Canada, they do have protocols for oral vitamin K. And I actually did a meta-analysis of all of those countries to see what each one of their protocols were. And I kind of came up with a meta protocol that actually fit within all of those different countries. And so, where, the advantage of an injection, it's one, it's done, you're done with it. We
Mhm.
certainly do tell families it's okay to bond with your kid and feed your kid first before giving the injection if that's what they choose to do. But it's also, giving a drop of vitamin K, based upon the set schedule that we share with people, is as effective as well. But as you said, we certainly strongly recommend against not skipping it altogether. We did have a baby a few years ago who transferred into our practice after the baby unfortunately had a brain hemorrhage. It was not a pretty situation. This child really was massively impacted for life, and it was probably an avoidable situation. So offering those choices but not skipping it is clearly something that we advocate for. Now, another one of the things that comes up very early, because it's a choice that has to be made right away, or should be decided upon right away, is feeding the child, feeding this baby. Talk to us a little bit about what and the types of recommendations. Obviously, when they come to us for the newborn care, they've already made that decision. Probably, hopefully, they're not holding off on feeding their baby until they see us. But at the same time, people do have options there, and so like, how do and then sometimes you may be even talking to a family who mom is pregnant, and but they're there with their 2-year-old or something like that. So talk to us a little bit about breastfeeding and like how you approach it and like what your thoughts are.
Yeah, so that is a very first choice. And a lot of parents have an idea, moms have an idea how they want to feed their baby prior to the baby being born. And many of our families decide to breastfeed and decide to breastfeed long term past the second birthday. And that's shown to have wonderful benefits for mom as well as baby's immune system. So that's a choice that we very much support. If a mom decided to formula feed or was unable to breastfeed for any specific reason, which sometimes medical reasons do arise, and we support the baby with the choices of different formulas, whether that be an organic, non-GMO formula. We try and steer them in the direction of what we feel are the healthiest for baby. Breastfeeding is, I would say, number one. 99% of our families decide to breastfeed, and we try and encourage that choice and help steer moms in the right direction so that way they can breastfeed successfully long term if that's their wish. And breastfeeding, I tell families, my line is, it's the most natural thing in the world, but it's brand new to you for these first time moms, and it's brand new to your baby. And although it's the most natural thing in the world, it can come with its own set of challenges. So we steer them in the direction of proper positioning and making sure that latch is correct at those first visits. And that's something that I've really pride myself on in trying to help those families get breastfeeding down in those first couple of weeks, because if they do and they can get past those first couple of weeks, many families decide to breastfeed for months or years.
Yeah. And one of the things what I'm trying to talk is to the families with newborns is, once they've clearly established this is what we want to do, I'll tell them I'm going to be hardcore on you until you tell me to stop being hardcore. But, in terms of like pushing you to do this because this is what you want. But I realize after 3 or 4 nights of maybe not sleeping so well, maybe there's some discomfort, etc. It can get a little rough. But we also know that, one of my core philosophies is what does every mammal do? And shouldn't we kind of be doing what mammals do as one? But we know that, again, as you talked about the positioning, etc., women were made to do this. This is what their bodies were doing. It's one of the things that I can't do and couldn't have done. Would have loved to have done it. But, certainly something that, that they are equipped to. Unfortunately, so many doctors' offices, they're not given the support. Oh, you're having a rough night, pop a bottle in your baby's mouth. Well, what's that going to accomplish? That's a short term. And if that's the way you want to go, we respect that decision. But that's not usually where our families want to go. Our families are very much into breastfeeding. And, well over 90% of our babies are breastfeeding very long term. And that's really much what we want to do. Even afterwards, then of course there's choices that come about relative to feeding babies even after breastfeeding, or when they start to bring in solid food. So kind of share a little bit about the choices and the discussions that you that come up for you there.
Yeah, one of the latest topics that has come up in the past several years is baby-led weaning. And a lot of families are choosing to go the baby-led weaning route when it comes to starting solids for their baby. And we recommend doing that around 6 months of age. And there are some milestones that we want to see baby accomplish before introducing solids or anything other than breast milk or formula. We want to see that baby's able to have really good head support, that they're able to sit assisted in a high chair, and that they're really interested in foods, that they're looking at their families eating, they're reaching for foods, and that's the sign that it's that they're ready. But when families decide to choose purees, it's a very easy, mush of a vegetable in a spoon that they feed to their child. Baby-led weaning is very popular nowadays, but it does come with its own risks. So I'd like to advise families on how to safely baby-led wean if that's their choice. So when doing baby-led weaning, I advise families to do still soft, texture appropriate foods for their children rather than anything that can be chewed off or bit off that could become a choking hazard.
Absolutely. And of course, besides eating, another very important part of newborn life is sleeping. And of course, not just that the baby gets sleep, but God willing that the parents are getting sleep too as well. Talk to us a little bit about the different types of choices that are coming up for people in terms of how they sleep and how their child sleeps, where their child sleeps, etc.
Yes. So a lot of our families do choose to have a family bed where they may co-sleep with their child. They may have a bedside bassinet where they're right up next to their bed. Some families I hear are very comfortable putting their children in a crib in their own room, or in their own room, in the baby's own room, or in the parents' room after the first couple of months. So we support the choice of our families, no matter what that may be. We always educate on the American Academy of Pediatrics recommendations for safe sleep. And if a family chooses to co-sleep, we advise on safer methods to do so. And how to keep that family safe is by limiting the amount of pillows, blankets in the bed. I love a co-sleeper in the bed, where a child can have a barrier between the parent and themselves. My first recommendation is always lowering the bed as well. I've gotten many phone calls of children rolling off the bed. Kiddos have always been great, but it definitely does lower the risk by lowering that bed to the floor. And if a family chooses to do so, that's always something I mention.
Yeah, absolutely. And there's other things that I talk about, such as you know, have pushing the bed, the mattress or the bed up against the wall, filling in the cracks so that the baby can't fall
Mhm.
in there. Having the baby more between the mom and the wall, kind of
Mhm.
reducing the rollover risk. But also, even if the parents are sharing a blanket, we don't want dad rolling one way, mom rolling the other way, and the baby's caught in the middle. We want to
Mhm.
make sure that they put the baby on top of the blanket, not underneath the blankets that we're doing. So there clearly are ways that one can do this. Of course, everybody's recognizing the importance of putting baby on their back as opposed to on their bellies because
Absolutely.
of the SIDS potential. So yeah, so there are certainly a lot of options that are there as well. And we certainly have lots of families who choose to maintain a family bed even beyond the newborn period. We have families who have several people in the bed, and infants and toddlers, etc. Let's face it, in certain cultures, in certain places in Africa, South America, there's a family bed until that child goes off and gets married on their own. So we want to be respectful of what those things are. But as you said, there are less and more safe ways about going about this. So for sure. Now, we alluded a little bit on vaccines and the choice when we were talking about hepatitis B before. We're not going to get into too much because we've done episodes on this already, and certainly people have heard my discussions and my beliefs about parents being able to choose how they wish to proceed with vaccines. But maybe you can spend a couple minutes talking about, like, just some of the things that are coming up from you when we, I know we ask in an open ended way. What is your thoughts about vaccines? How would you like to proceed? Do you have any questions about vaccines? But maybe share a little bit about some of the things that you hear and like some of the guidance that you give based upon that.
Yeah. So for immunizations, a lot of families do decide to come to us for a more individualized, personalized vaccine schedule if they are not comfortable with what was presented to them at other pediatricians' offices. So I always bring up risk and benefit for every family, and I want families to make that educated choice, to have education and facts behind what their choices are for their children. And when it comes to immunizations, a lot of families are feeling, nervous or unsure, and especially a first time family. So I always like to break down each vaccine one by one. What does it do? What does it look like? We give a lot of reference to looking at the American Academy of Pediatric website, as well as other vaccine literature. So I always like to share all of that. But I hear a lot about how do I support my baby's immune system during the time of the vaccines? And that's where I love to educate about if a mom is nursing, we can optimize her vitamin D and zinc levels and make sure that the child is on proper probiotics if they were a delivery of a C-section or received antibiotics during labor, and making sure that that baby is really, really as ready as possible to receive those immunizations. And then we also have an immune support protocol that we recommend around the time that the vaccines are given, that all of our families have done. And yeah, that's much it.
Yeah. And my approach has always been, if a family, when families, if they just say, hey, we want to have a little bit more personalized approach in your office because we know that you're not a big office, and we know that we're going to get to see the same providers and get to know everybody. We've heard about how you approach that, or how you are with that in our community. But if by all means, if a family says, I would like to follow the CDC's recommended schedule, of course, that's their choice. And of course, we're going to do that for them. And if a family may say, hey, these vaccines I think are more relevant than these vaccines, how can we proceed with those when can you put an individualized schedule together? And of course, we're going to respect the family who says, hey, we're not going to do that. This is not what we want to do. We always want to engage them in such a way that, would it, how are you, where are you coming from in terms of the decisions that you're making? Of course, we're wanting to make sure that people are using accurate information. I've certainly myself seen people bring in books from the 1970s, and I'm like, good book. I mean, I'm glad that you read that. We don't even, those vaccines, those older vaccines, they're not even used anymore. So I still every now and then hear somebody say about, hey, I don't want to do this because I don't want to give my kid mercury. And I'm like, well, there's been way over a decade since there's been mercury in any childhood vaccine. So some people just don't know that. And some people will say, oh, well, that may change things around for them, or it might not. But the most important thing for us is to give them the latitude for them to feel comfortable with their decision. So I know that we will ask at every appointment going forward in a very non-threatening and a very open-ended way. I know that you had made a decision that if you told us that you weren't planning anymore, do you have any questions about that or any change of heart? I know that you had said that you think that you will do some eventually or get started eventually. Are you there yet? What questions do you have of us that we can help with your decision? But ultimately, as our show name, Your Health, Your Choice, it's the families who get to decide this. We know that that's what informed consent is all about, is being informed, not just consenting. So, obviously it's great that we are able to offer those to families who watch that, because we know that in a lot of pediatric practices, if you're not following their way, then you get the boot. And we end up getting a lot of families from that. There are doctors out there who give them the boot, but they always say, hey, there is a board certified pediatrician in town who's doing that. And I'm not sure if they're doing that just to push them off on us so they don't have to deal with it anymore. But we do get, do hear that someone said, oh, well, there's a doctor out there who's willing to work with you on this. And so I think a lot of families say, hey, you guys are pediatricians, pediatric providers, you kind of know more about this, because, one of the things that I've learned is that if you push people away, then the kid often will not get the adequate health care that they need. And, whether a person's vaccinating or not, we still need to monitor those children's growth and their development and that their nutritional status, and make sure that everything is proceeding as it needs to be, because we, of course, can step in whenever we need to. Now, another thing that we often hear about is education choice. Certainly, many people grow up in a public healthcare, in a public schools setting. But of course, in our practice, and as well as everybody, not just in our practice, that there's education choices that are available as well. So maybe talk a little bit about some of those education choices that we're either asked about or that we're hearing about.
And that is something that once children start getting to a point of entering school, I hear a lot of questions about. It's really interesting to see a family's choice and their reasoning, and because no one knows the child better than the parents. And that's something that we support and we foster, is that parent autonomy. And a lot of families some of our families, I didn't say a lot, but I'd say a good portion do choose to homeschool their children and decide to, and if that is a choice that they make, then that is something that we help to encourage and ensure that they're on a good curriculum, that they are doing co-ops or having regular peer interactions, because that's so important as well if their child isn't going to a public school setting.
Yeah, absolutely. And we hear about different types of homeschooling environments, and there's the charter school options that are available. There are public charters, there are private charters. There are people who wish to take a more have a religious part to their child's education as well. And again, just like everything else, we want to be supportive of them. I'll certainly sometimes get asked questions about certain types of curriculums or certain types of schools, and a lot of that will come up even as they get into middle school and high school, when they have other choices to make. Some families feel that they were comfortable homeschooling their kids when they were younger, but some parents are like, okay, this is way beyond my knowledge at this point. I need somebody else to step in here. Or, hey, I'd like for my kid to be involved in a larger school setting, but I just didn't feel my kid was ready before. That wasn't what we wanted. So again, wanting to make sure that we're respectful of their choices and wherever they land, and help them accomplish their goals there too. Now, I thank you for going through all that with us. One of the things, we're going to get close to wrapping up here now. But one of the things I also wanted to just kind of hear from you is, trends that you have, been seeing over the 6+ years that you've been with us in the holistic pediatric world as its own. So, talk a little bit about some of the trends that you're seeing.
So some of the trends that we have really been encouraging families or discussion with families for a very long time that has started to become more mainstream. One of the first things that comes to mind is vitamin D. And a lot of that came about with a lot of your discussion with families came about of articles and studies that have shown good vitamin D levels helps to prevent children from catching the flu or catching severe cases of the flu. And we're finding now that that's the same with COVID. And so having families optimize their vitamin D levels, we see such an increase in their immune system and the benefit that that provides. And also allergen introduction earlier on. So I remember, probably 4 years ago now, all of the allergy groups and the American Academy of Pediatrics really made a complete 180 and really recommended starting to introduce allergens, peanut butters, other nut butters in a proper form texture for baby to introduce those after 6 months as one of the first foods to try and desensitize baby from developing a peanut allergy or a severe peanut allergy later in life. So those are some of the things that I've seen you begin to talk about and then have really kind of taken off and have become more mainstream.
Yeah, and probiotics, of course, as well. Now it's kind of mainstream to be, if a woman was on antibiotics or if the baby was born by C-section, of making sure that they have that good flora, knowing how important it is to set the gut flora, the microbiome from the very beginning in terms of immunological responses, in terms of growing a healthy gut lining to help optimize absorption. And those are things we've been saying forever. And it's kind of interesting. I find that a lot of the things that I was really focusing on kind of about 5 to 10 years later, then it's the green sprouts start showing up, and then all of a sudden that becomes kind of a natural thing too. So, it's kind of nice to see that the world comes along, fortunately, because as a private office that we are able to kind of do our thing. We're not beholden to large corporation medicine who this is the way we do it, or, and not beholden to that. So we're allowed to be a lot more flexible in our office because of the size and our approach to things. So yeah, those are certainly some good trends. All right. Well, thank you so much, Patsy, for taking the time to speak with us and to introduce yourself to our audience. We have other providers that I hope that we'll be bringing on as our time comes on, so people can kind of get to see some of the other people who we've chosen to work with and who have come aboard us. So it's been so great. Please, if you haven't subscribed already, please do subscribe to our YouTube channel and join us on our other social media platforms. Please spread the word. We're really trying to get it out there. We've kind of moved from this space of working with families on a one-to-one basis that we really want to try to spread the word out there. We realize that what we talk about seems to speak well to a lot of people, so share the love. So thank you, Patsy, for being with us.
Thank you so much for having me.
And I hope everybody has a great day.